Hello everybody. This week we are studying the check-in process of the medical billing cycle. The first thing we need to determine is whether or not the patient is a new or established patient. New patients are those that have not been seen in the practice at all, or at least in the past 3 years. And established patients are those that are ongoing and have been seen in the past 3 years. There's a lot of information we need to get from the patient when they first call for a visit if they're a new one. We need to make sure we get their name and phone number, all the contact information, their address, birth date, all that type of information. We also need to make sure that we know why they're calling in, and if they are referred, we do need the information from the referral, and if they have a referral sheet, we'll need them to bring that with them. All scheduling of appointments are done through, usually now, through an EHR system, an electronic system. Very few are still done by the paper method, but there are some specialties such as psychiatry that do. One of the most important parts for the patient is whether or not the physician is a participating provider. That means, are they within your network? And you should have this information from wherever you purchased your insurance, whether it be through a company or purchased your own, but you need to know what your networks include. It will make a big difference. So those physicians who are in network are called participating providers, or PAR. If they are non-participating or out of network, they are called a non-PAR provider. And that will make a big difference on the amount that you're going to have to pay and what your insurance will pay. Think back to the last time you went to a doctor's office. They probably gave you a form to fill out on your medical history. They want to know all kinds of information about how you are physically, what diseases, and any medical history that you have, your family's history, your social history. And then there's also usually a form that has the patient guarantor insurance data. They want to know all of the information for insurance purposes and who they can contact if you are needed, or somebody is needed in the case of an emergency. The policy numbers and all that. They usually take a picture of your card front and back so that they have that in there also. This is an example of what your insurance card might look like. It does have all the identification numbers, group numbers, that type of thing. When it was effective, that's extremely important. Usually on the back side, it will have if you are covered in a prescription drug plan, if you have a vision plan, if you have a dental plan, and it also has phone numbers that you can contact any of these specialties that are covered under your insurance, and also it has a number for pre-authorization, and we'll talk about that here in just a little bit. Most practices now also take a picture of you, or take your thumbprint or your handprint, something like that, that they have as some type of identification for you. They also have a form you need to fill out. It's called Assignment of Benefits. Basically what that says is you allow them to file your insurance on your behalf for you. The contract is actually, an insurance contract that is actually between the patient and the insurance company, not the physician and the insurance company. So physicians actually file claims as a courtesy to you, but it also makes sure that they get everything submitted correctly and that they receive payment a lot faster. They also usually have an acknowledgement of the receipt of notice of privacy practices. They give you a copy of what their privacy practices are and have you sign that. That usually happens every year, and actually most of these paperwork has to be completed every year because they want to make sure that their files are up to date. If you're an established patient, they're probably just going to verify that your information is correct and ask you if there are any changes that they need to be aware of. You may get a new case record if your chief complaint or what you're coming in for is different from the last time you came in, and there may be one record or new case for if you have a chronic disease that they keep adding to constantly. They will try to verify your insurance information before you come in, because this makes it possible to establish what your portion of the bill is going to be. They're going to determine whether or not you're eligible and if any pre-authorization or referrals are needed, and if there is more than one insurance company, who's primary, that type of thing. And we're going to cover most of that here in just a few minutes. The first thing we're covering is the factors that affect eligibility. If it is an employer plan, they need to verify that you are still employed and that the insurance is active. If it is an HMO or PPO, they need to verify whether or not they are in network or out of network, and that type of information. They will also check to make sure that the specific benefits that will be covered during that visit are covered through the insurance company, such as do you have coverage for x-rays and lab and maternity, any of those type things. They're checking to see if they're in or out of network, as I said, and they're also varying how much your copay or co-insurance is. Copay is usually what you pay your physician if you are an HMO or PPO. Co-insurance may be for other types of insurances that you have a percentage you have to pay instead of a set amount, which is what the co-payment is. Most of this can be done electronically. Sometimes you do have to call, and it's good to get a really good relationship with the insurance provider, your contact there. But the best way to do this is through electronic means. We can get more information. It prints right out for us. It's fantastic. It'll tell you everything they need to know. What's the copay, deductible, out of pocket, who's covered, when they're covered, who's the primary care physician, do they have any specialty physicians. All that type of information comes through when we're doing an electronic one. If the patient is not covered, we do need to let the patients know this, and there's a statement they have to sign, especially for Medicare. It's called an ABN, Advanced Beneficiary Notice, and that lets them know that these are the charges for this visit. It is not covered by Medicare, and you are going to be responsible for it, and they have to sign that. And they do that for all the insurances because they want to make sure that the patients are aware of what they're going to owe, because most of that they're going to try to collect right up front. Pre-authorization is usually required if a patient is going to have some type of therapy. They're going to be admitted as an outpatient clinic. They're going to be admitted as an inpatient. These type of things, they have to have pre-authorization. Your insurance company determines from the information sent to them by the physician whether or not the procedure is necessary and covered, and that this is the all information that dealing with what they're going to do to treat that patient. You may need to have a referral, and that's where they send you to another physician that may be a specialty that if you're seeing a GP, they may not be comfortable or have as much knowledge of what might be going on with you, so they'll send you to a specialty physician. You do need a referral for that. For most insurances, there are some where you can self-refer. If you have to have a referral from your primary care, which is also known as your gatekeeper, then there's a form that needs to be sent also that you have to take with you when you go to the doctor, to the referred doctor, so that they know that this is a referral. Now, sometimes it's possible that there are more than one insurance that will cover the patient. Could be 1, 2, 3. You don't see this as much as you used to, but it does happen. The primary insurance is usually the insurance that the patient carries, and their spouse may carry insurance on them also. That might be their secondary insurance. All this is dealing with what's called the coordination of benefits, and this is there to make sure that if the patient does have more than one insurance, then the maximum benefit payable is paid without any duplication. They don't want both insurances paying on the same amount. For example, if your bill is $10,000 and your insurance pays on it and they pay $7,000, then what's going to be filed to the secondary insurance is only $3,000. You will not file the full amount. or actually you'll file the full amount, you're going to see the payment, and know that they only have to pay on $3,000, because we don't want them paying on the 10, then you're going to get paid too much money. Now, it gets to be a little crazy when you have children, especially if they're covered by both parents. If that's the case, then it's determined by the birthday rule. And the birthday rule is whoever's birthday comes first in the calendar year. You don't look at the year, you only look at the month and the date. Whose birthday comes first? That would be the primary insurance. Now, if you're dealing with divorced parents, it's a little different sometimes. If both parents have custody, if they split custody, you still do the birthday rule. If one parent has custody and the other one just has visitation or something like that, then whoever has custody of the children, their insurance is primary. Now, some places do use the gender rule, and the gender rule states that the male or father plan is primary. You don't see that as much as you used to. Okay, this is an encounter form, a copy of what one might look like. And your doctor's office may be a little differently set up. There's different ways they can do this. Basically, it just says what you have done that day, what your diagnosis is, your name, all that type of information is on there too. It does have all of your lab, x-rays, injections, any of that type of stuff is on here. And sometimes they put the fee on there, sometimes it's an automatic part. It'll be on there also. Now, communication is the key component with everything. You need to make sure that you have a good communications relationship set up with your physician so that there are any problems that you can go to the physician to help get that straightened out. You should also have a very good relationship set up with the insurance companies. Know who your contact is. Usually after a while you know each other by your first name. Have your phone numbers for them handy if you're actually talking to them, trying to get some follow-up on a claim or help with a claim. And make sure that there's a good relationship with the patients. Always be friendly, helpful, polite. It goes a long way that if a patient walks in and they're real upset, the first thing you do is you could say any of these expressions down here. Most patients just want to hear, I'm sorry that happened to you. Let me look into it. That will go a long way to diffuse any type of a situation where the patient is really upset. If you can't get them calmed down to where we can actually talk to them, you're kind of defeating the purpose here. So make sure that you keep that relationship there. Greet all patients when they walk in. Don't ignore them. And kind of keep them up to date. If it's taken quite a while in the office, let them know. Keep that relationship positive for all your patients. Okay, that's the end of Chapter 3. I hope that helped you. Let me know if you have any questions. You also have a test coming up soon, so start studying for that. It is a time test, so you do not have time to go look up the answers. You need to study these first 3 chapters before you take it. It's mostly multiple choice, I do believe. And good luck with it. Let me know if you have any questions.